So welcome everyone again for a new learning resource on public procurement of innovation within the healthcare sector. This is part of the InnoSupport project, and today we're talking with Dr. Ana Miquel Gomez, and she is advisor in innovation for primary care for the General Manager of Healthcare Services in Madrid. And we're super lucky to have her here today because she has a lot of experience throughout her whole career working in the healthcare sector from both ends, so to say, but also she has done a lot of different procurement projects of innovation. So today we're going to get some insights from her about how to manage even multiple projects at the same time. So thank you very much, Anna, for being here. Could we maybe start with an introduction about who you are, what you did, and some general information?
Thank you, Esma. And thank you to your university by giving me the opportunity to share all these lessons learned from my experience. Now, in fact, I am advisor of innovation for primary care, but my previous position just till last August I was the main responsible of innovation and international projects in Madrid Ministry of Health and for Madrid Health Service. But previous to this, I was general manager for primary care, and I was in charge, for example, of the ITs of research, of quality management, and I was medical director, for example, in the emergency medical services in Madrid. But I have always been a very technical in a very technical positions. And one of the things that I was in the past, I was associate professor for one university here in Madrid, a public university, Rey Juan Carlos University. And also in the past, during almost 5 years, I was researcher for Berkeley University, and in evaluating innovative models of provision of services in the health services, for example. And also I was cooperating with the Integrated Care International Foundation in the past. So my experience is not only as a family physician, that now I go to the office every week, 2-3 times. Not only as my experience in strategic planning and management, but also the experience of this more technical aspects and the key elements that we can consider when we face a situation like this, to face huge projects, ambitious projects that you have to develop in a short period of time.
Super interesting, thank you. And we're very excited to hear the insights that you got from these projects. Thank you.
Okay, so let's start. These were our 3 ambitious projects. We have 3 challenges. One of them was IntegraCam, that it was a project of telemonitoring elderly people with risk of fragility. The other project was Medigenomics. Medigenomics was a project that it is a platform that includes all the process of management of the genomical data. And the third one was Infobanco. Infobanco was as a data space for primary use and secondary use of the data. So very, very ambitious projects, and my role was to manage the 3 projects at the same time and to coordinate the 3 projects. So how we did it? This is the process from the beginning. I start with the project in January of 2021, and the first step was to launch the website. But the second one was very relevant, was the open market consultation with a lot of attendees, more than 100 attendees to the technical workshops and the conclusion workshops that we established. And you see more than 30 proposals for the open market consultations. And then we use all these conclusions to designed the tenders in less than 6 months. After this designing of the tenders to the tender launch, well, we received an award to the best public procurement of innovation initiative in Spain. This was a real surprise, but it made us very happy. And well, after the tender launch, we have to publish all the tenders and all the specific technical specification till we establish the contract. And then we start working with the projects, the 3 at the same time, with all these milestones from April, May 2022 to 30 of June of 2023. So in 1 year and a half, less than 1 year and a half, something more than 1 year, we have to develop these 3 ambitious projects. And after that, we have to make the evaluation because they were projects that were co-funded with the Europe Union. So what were the main lessons that we learned? First of all, about the open market consultation. I think it's a key element because when we face this kind of challenges, we think we all know what we want to do, how we want to resolve, but this is not true. We have some information, but when we collaborate, when we cooperate, when we co-create with the different suppliers, the results are much better. So the first lesson that we learn is that learning and co-creation is a key element with the suppliers and with the rest of our partners. So, and the open market consultation were very, very, very good to improve our challenges and to improve how to resolve them. The second lessons that we learned, it was about this bidding process. Here you have all the different steps from we have the final versions of the tenders till we establish the contract signing. This was a lot of steps. If you count it, there are more than 20 steps. So, and with participation of different departments, it has to have an approval of the government because it is a public organization. We have to cooperate with legal services, with intervention, with procurement services. So when you face a situation like this, and it is a quite complex situation, you have to try to align all the participants units from the beginning. And this is a key element, a key lesson learned during this process. And also that if you know that this is in a short period of time, you have to use all the emergency procedures, keeping the transparency and the legal aspects very clear, but use all the emergency procedures that you can. So align all the participating units from the beginning and process with emergency procedures. Another of the lessons learned is that when we start to develop all these projects, technological projects, with in just a little bit more than a year, we have a lot of risk, and we have to face this risk. You have to identify the risk. You have to try to monitor, prevent, and manage the risk from the beginning. And this was also a key element. One of the risk was to develop this project in a short period of time. And also the participation of a lot of experts during the project. But we transform this risk in opportunities. When you manage the risk and you establish quality action for risk management, the results is that you can change the risk by opportunities. Another key element was the organizational structure. Remember that these 3 projects were being developed in parallel at the same time. So around 226 people were involved in the projects. So we have to create very agile, very dynamic structure. Well, we were the leaderships, the global project development management and coordination. We were in charge of it, but we have the contractors, the suppliers. We have a technical office of projects that give us support in legal aspects. And at the same time, we have an expert group with different profiles. So we establish different kind of meetings, weekly meetings, monthly meetings, to be very agile in the development of the project. So maximum collaboration, maximum co-leadership, and transparency is a key element. Another key aspect was during the development of the process to use methodology that helps, like the agile methodology that establish different steps in which you review your goals with small goals. And for example, was one of the methodologies that we use. The other methodology was to run and to work at the same time in parallel with the different challenges, and to make them to finally fusion in the last challenge. And the use of methodology is very, very useful for the development of this project. So don't try to do it without methodology, because probably you are not going to achieve all the goals. And final, but evaluation. When we talk about innovation, there is no innovation without evaluation. How we did it? We established two kinds of evaluation. We established an evaluation of the project. The validation plan includes KPIs for all the activities that we have to develop. We have the contract, we have the technical specification, we establish all the activities that we have to develop, and we create KPIs that we evaluate for each one, like a checklist, okay? And also we establish a result and impact evaluation plan. Sometimes it's not easy because they are innovation projects, but it is relevant. And how we establish these KPIs? For example, we establish KPIs for the use case results, for example. So in one of the projects, we could establish system outputs in terms of health KPIs, economic KPIs, and experience of patients and professionals KPIs. But another result, for example, was how this was the origin of the participation in another European projects. And also we evaluate a survey with the professional experience of the professionals that participate in this project. So never forget to take on account and to take time for the evaluation, for the monitoring of the project, and for the evaluation of results. So these are my main conclusions. If you want to achieve huge challenges, ambitious projects, first, learning and co-creation is a key element. You cannot do it alone, and you have to share your experience, your knowledge, but co-creation. It is just not a collaboration, it is a co-creation. You have to try to align all the participating units from the beginning. They have to make this project, they have to make the project their own project. They have to be part of the project. You can use emergency procedures in these ambitious projects. You have to identify, monitor, prevent, and manage risk with quality measures. You can be helped by methodology that are essentials for the development of the project. And of course, maximum collaboration, leadership, and transparency during the whole process. And this is my final recommendation. Collaboration and co-leadership is a key element for this process, for the projects. These projects are ambitious. A lot of people has to collaborate to create something really innovative, and collaboration and co-leadership is the main key element of the lessons that we have learned. So I hope you will enjoy this video, and it will be a help for you for your learning process, and I hope to see you again.
Thank you very much. I think this was absolutely amazing. First of all, congratulations on award 2. But for me, I think we talk a lot about innovation and about doing innovative projects, but one of the challenges is always how do you scale it up? How do you do multiple projects? That's one thing where we have already had many trainings and events about, but I think this was a perfect example for me at least to see. So how do you more or less routinize it? How do you do it more often? And I think we've heard some previous learning resources which very much relate to this in terms of how to do an open market consultation, but these parts about risk identification, about evaluation, about the methodology, I think are super useful for people who want to do it more than once and who want to more or less routinize it. So I think that's really great. Thank you so much.
Thank you too. Thank you too.